Also, I would like to invite Dr. Rajiv Lochan to join us for the panel discussion. It is going to be on controversies and nutrition, oils, fats, ghee, sugars. I would also like to invite Mrs. Ishi, Khosla and Mrs. Jyoti to join us for the panel discussion.
Distinguished delegates, last 3 sessions, we heard the illustrious speakers and panelists to discuss on the various aspects of disease, chronic disease. Ishi Khosla, the celebrated nutritionist, has already told you the role of nutrition in health and disease. And now it is said that we Indians thrive in controversies. And Khushwant Singh was the one who was the most illustrated editor, but he thrived in. Therefore, the topic is controversies, doubts, and the question-answer session has been settled in this session only so that whatever the queries, the questions, and we can ask them.
I think we'll start off the discussion with a common scenario that we feel, that we very often see. A young person, 40 years of age, he comes with some chest pain, he wants to get evaluated. We evaluate him, we say that he has a family history of CAD, but most of his reports are okay, but his LDL is 140. So as far as diet is concerned, Ishi ma'am, what would be your suggestion? And Dr. Sawhney, what can add on to what would you suggest in a young person, 40 years, with an LDL of 140?
Yes. These are very common situations. First of all, we would do a BMI and a waist measurement and look at the diet. Basically, I would put him on an anti-inflammatory diet. I would look at his other markers in terms of his vitamin status, his vitamin D, calcium, magnesium. Now, this is a great opportunity for me to bring out something which is really unrecognized and very difficult to even diagnose. Magnesium deficiency. Now, magnesium is a single most abundant, one of the most abundant minerals, and also in our diets, but somehow we are lacking in it, and the serology, the blood work, does not give us the exact picture of cellular levels. So even if you have a normal magnesium level, we could be seriously deficient in our cells, and this deficiency itself, when you correct, we find, or bring it up to optimum levels, we find a lot of correction in all the metabolic markers, blood sugars, LDLs, triglycerides, even heart rates and blood pressure. And magnesium is one mineral which is responsible for 300 functions in the body. And so it needs to be, and it's one of the safest minerals to be, taken. If excess is taken, it's, excreted. However, it should not be taken, by anyone without being under supervision. But correction of these, vitamin D, magnesium, plus looking at the anti-inflammatory aspect of the diet, looking at meal times, belly fat, is good enough for me to get my results.
Dr. Sawhney, would you like to add something to that?
She has said some additional thing which we are not aware much. But I think if a patient has a family history and coronary artery disease, getting MI at the age of 40, very high cholesterol, there is a family history of premature heart disease, I think he is the case. What we are dealing is a familial hypercholesterolemia. Is an underdiagnosed, undertreated condition in the country. Our paper, which was first one of the eye-opener, have shown that young heart attack patients in our country are more than 50%. And among the young heart attack patient, what we have learned is that if you have no associated risk factor like smoking or diabetes, and only high cholesterol is there, lift the upper eyelid and look for the arteries. If it is there, it is nothing but
Niche.
Bottom.
So what we have seen that these are the patients which are suffering from familial hypercholesterolemia. The importance is that it is not only to treat the index patient with young heart attack, with family history, high cholesterol, no other risk factor. always think, if a patient of young MI comes to you, no associated risk factor, think it is FH. FH means it is not simple high cholesterol. You are not only treating the index patient, you have to do a cascade screening. Cascade screening means get a non-fasting lipid profile of the brother and sister and the children above the age of 8 years. And what we have learned in our 1300 patient data, which is just publishing another one now, they've shown that on average from single index patient, I get 2 more patients. Because all the first degree relation, even children, they are having very high cholesterol. So if a child has a cholesterol of more than 160, or a brother sister have a LDL of more than 150, then he is a carrier of FH. If a carrier of FH at any stage, I will give him statin. Nothing else but statin. That's one. 5 milligram of statin for a child of 8 to 10 years is beautifully working. We have to keep them below 130. For adult, we want to keep less than 100 milligram. Because by identifying an FH patient, you're not treating an index case, you're treating a family. And in return, you are preventing a premature heart disease in the society significantly. Because we have 50 lakh population in the country with familial hypercholesterolemia. So that question is very important, that we have to give them statin. Don't worry about statin. Children statin, I've got 17 children with me now, those who are on statin after the age of 6 years. They are taking statin. They were 239, 240, 250 LDL at the age of 6 years, 7 years. Clear-cut case of a FH carrier. And we have started them of statin. I'm sure the data of 25 years of statin in children has clearly shown it is a safe drug, do not interfere with the growth, and nothing happens. It is doing very beautifully well.
Just one more comment before we move on. And I have been practicing in a heart hospital for many years, and as a nutritionist and dealing with these patients, one of the single most, we know low HDL is independent risk factor for heart disease. And we tried everything, including activity, increasing physical activity, giving a glass of wine, reducing, the wrong kind of foods. Yet, I never saw a patient whose HDL went up. It just did not, it did not happen. And the single most important, I think, observation I would make is that through this anti-inflammatory diet, in fact, today I feel a low HDL and a high LDL are a sign of inflammation. And we know that the liver makes cholesterol, and when there is inflammation, it may be a protective physiological mechanism to protect the body in some way. The cell walls are made up, cell membranes are made up of cholesterol. So in any way, whatever the mechanisms are, this diet elevates HDL like unbelievable. And in my patients, in my family, I have observed it in my own case. I used to have an HDL of 40, 45, and today it's 70. And it's singly just addressing inflammation. And, then the LDL value itself becomes not so relevant.
Yeah.
So.
Thank you. Another, Jyoti ma'am, the next question which I'll address to you is that we do an angioplasty on a patient. The patient's family immediately comes to us. We have been eating mustard oil for last 10 years. Why did this happen? So what is your suggestion as far as oils is concerned? What do patients of coronary artery disease or in general population at risk of coronary artery disease, what oil combination would you suggest?
See, we as Indians, people just go fancy on olive oil, which is a good source of monounsaturated fat, and our mustard oil does that, a little amount. So we normally do a combination of, for a layman also, when they come to in the OPD after angioplasty, or when we are going to the ward to counsel a patient. So first question is, kitna khana hai? Because they are fond of fried food and all. That's why they landed up in such situation. So the combination of MUFA, PUFA and saturated is important. So all the three things, if we add in the diet, taking their choices of food and preferences, what they eat and how they can cook the meals accordingly. So we normally suggest the patient to have sukha sabzi in sarson ka tel. They have for monounsaturated fats, which are our soya bean or sunflower oil. So we tell them they keep on changing on monthly basis and do take saturated fat in the form of desi ghee. So they have to curtail on dairy products so they can, have their saturated fat from there. So simply I tell them, so in you have suka sabzi in sarson ka tel, tari wala in refined oil, and you make your dals in desi ghee. Suppose you do, for that day you want to have a paratha. So make a simple stuffed roti, which is high carbohydrate one, or you stuff any green leafy vegetable or cottage cheese to it, and then make it suka and put a spoon of desi ghee on it. So you can enjoy your meal also. See, that's what our taste buds are, we are born with. So we have to make as per their preference, the choice and the taste. And if we have to plan, we have to see their LDL, HDL levels. So accordingly, we suggest the oil to that patient.
Yeah, very true. So I think the answer to that is that we have to have a balance of all oils in limited quantities, and the balance has to ensure that we get the best.
See, 30 years back, I was asked a question, which oil is best? Same questions today. My answer is same. No oil is best, no oil is bad. All oils have qualities, good and bad qualities. So what I tell my patients is, 3 किलो घी घर में यूज़ होता है, 1 किलो देसी घी, 1 किलो सरसों का तेल, 1 किलो और ऑलिव ऑयल जैसी चीज़. देसी घी for cooking, deep frying, rest you already said. Thank you.
In fact, we normally suggest these patients to have around 15 grams a day, because they have to have their nuts. So that oil comes in invisible form to you, and which is a healthy fat, omega-3, omega-6, which we get from our nuts and seeds. So we suggest them just 15 gram, and I tell them to, you have boiled dal, but sabzi aap bana lo. So that, that is also tasting good, and your vegetable is also tasting good.
What about krill oil? Is there any role?
No, we don't suggest. What is your not for cooking.
Not so much. Fine. There is one common problem that we are facing as far as young patients is concerned, is the use of energy drinks. Lot of young people, Dr. Sawhney, what is your opinion on that? Lot of young people have been, they in the evenings are consuming half a bottle or a bottle of an energy drink, and it is being bombarded on us on the social media. So what do you feel? Is there any role? Should we be restricting the energy drinks?
Yes, I think they have no role. We should not. Even the children going to gym, I have experienced last 1.5 years, I've got 5 children, those who developed heart attack between the age of 22 to 29. We searched the literature. We did not find any risk factor. Only thing what we found was, one of those was a lot of energy drinks, and whey protein BCAA, branch chain amino acids, and all jars of amino acids. And then we searched the literature from China, from South America and everything. This was found to be one of the most important offending agent for heart attack in young children. So I think maybe for energy drink, she will be able to tell you anything more detailed.
Yes, I think I totally agree with Dr. Sawhney here, and I see it in my clinical practice. Particularly scary is whey protein and soy protein, and like I said in my talk, that there has become a protein obsession among youngsters and adults. And recently I had a patient, there are several of them, and this was a young patient who had reacted badly to the vaccine and had tummy issues, and she had uncontrollable diarrhea. Nothing except a gluten-free diet helped her. And then she went and hit the gym after a few months and started exercising, and she was given the box of whey protein. And a few weeks later, she again called me, and my symptoms are back. And I said, listen, you are intolerant to wheat, so kindly do not touch the whey protein. It will be contraindicated. No, my trainer has said, how will I feel so good, I feel recovered in the morning, what will my breakfast be? After a lot of hesitation, she gave it up, and I have such a profusely emotional message from her, saying that again you have sorted me out. It was a single most, her appetite had gone, her diarrhea had started, everything had gone wrong. So yes, these are pro-inflammatory, and they need to be taken seriously, and a huge problem among the youngsters.
Yeah. Another fad that is going on in society is intermittent fasting. So what's your opinion on intermittent fasting? Do you think it is healthy? Do you think it should be advocated in general population?
Well, I am somebody who's always agreed and believed in the practice of fasting. And what matters is what do you do in that fast. Simply picking up fasting and eating junk in those 8 hours is not going to work for you. Simply eating from 8 o'clock until the early morning at night will not work. So what you eat is important, and the quality and the timing is also important. If you are able to deal with it and you don't have any other major health risks towards long gaps, I think it is a very good way of cutting back on unnecessary eating hours and eating badly, and makes you focus on food. It makes you more mindful, and it definitely helps to recover and reset and detoxify the body. And there is enough literature supporting it also. But I think it's all about how you eat and how you do it.
Thank you very much. I think everything good comes to an end. We had a very exciting and enlightening discussion on this. With this, we come to an end of this session. Thank you very much.
I request everyone to join us in the memento.